For the first time, the federal government is getting ready to negotiate with pharmaceutical companies over the price of popular drugs under Medicare. President Biden's plan to lower prescription costs was part of the Inflation Reduction Act passed last year. And joining me now via Zoom is pharmacist Jamie Latko, the owner and pharmacist at Niagara Apothecary and a member of the Pharmacist Society of the State of New York. Jamie, thank you so much for joining us.
Oh, you're very welcome.
First, can you just talk about the high costs of some of these specific drugs? Like, what do you see people paying out of pocket for some of these?
Um, it's our system is so convoluted. We can see people paying like $3 and then hundreds of dollars. And the drugs that they're targeting are the biggest culprits, but they're actually some of the most vital medications we have out there right now. Um, we say every day, drugs are either costing $600 or $1,000. The price of drugs have just gone through the roof, and it doesn't need to be this way.
Yeah. We just showed a list of those drugs. I can't even
Yes.
pronounce some of them. But tell me what some of the, conditions they treat.
So basically, blood clotting, serious heart conditions like AFib, and diabetes and heart failure. So these are like a really critical drugs. And then we have Enbrel up there that is and for many of the autoimmune diseases like uh, rheumatoid arthritis, lupus, that type of thing. But these are blood thinners, diabetes medications. So these are medications people can't live without.
Yeah. Now, do you have stories of people coming in and saying, I can't pay rent this month because I'm paying for
Yes.
this drug? You do. How often does that happen to you? Maybe tell us some of those stories.
Well, yeah, they can't pay rent, they can't pay their bills, they can't buy food. Um, we're always trying to find cheaper alternatives, but in some instances, the cheaper alternatives are not the safest alternatives for these patients. We're always looking for samples for them and coupons, but unfortunately, in the Medicare system, most coupons cannot be used. And yeah, it's heartbreaking. We're always just trying to find alternatives to get them their medications. There's some really wonderful healthcare programs out there. It's kind of all going off the whole social determinants of health is finding what these people's needs are and then trying to hook them up with those needs. The disheartening thing is I'm looking at the details on this program. It's 2026. We don't need help in 2026. We need it now. Look at the price of milk and eggs. People can't afford food, and certainly they can't wait till 2026 to start affording their medication.
Yeah, I just want to, add to that. The negotiations are now just starting. That's
Right.
what was just announced. Those negotiations will take a couple of years. So 2026 is the first time we'll see an impact
Yes.
on these prices. In the future, the federal government can, use up to 50 more drugs to negotiate the prices on. What other drugs would you like to see lowered in price beyond these first initial ones that were announced?
A lot of the asthma medications and the COPD medications, all the inhalers, five, six, seven, $800 inhalers, and just super expensive. And the diabetes medications, we call them the GLP-1s, the Ozempics, the Trulicities. Everything costs thousands of dollars, and it's really a crisis.
Yeah. And then lastly, could these lowered prices impact you, the local family-owned pharmacies, at all?
Well, yes, and actually, the pricing now is impacting us. Our our system of pharmacy is not like the old days. I've been doing this quite a while now, and we are in an era of too many players in the field of pharmacy. We have middlemen, PBMs, pharmacy benefit managers, that are doing nothing other than acting as a pass through, and they're taking a lot of the money that could be saving the patient. So the scary part of all this is how are they going to establish these prices if we have these PBMs still involved? And right now we're in a system where these PBMs assess what they're called DIR fees on the pharmacy, and we'll dispense a medication. And believe it or not, most people don't believe it. 4 or 5 months later, they claw back money from us. So I may dispense $1,000 medication to a patient, and 5 months later, they assess $100 fee on that prescription and they take it back.
Wow.
And I don't know that they're taking it back. And you just never know what you're up against. January 1st, it's going to be where they are at the point, those fees are going to be at the point of sale. But unfortunately, when that happens, we're going to know right up front if we can fill a prescription or not. And there's going to be more prescriptions that we cannot fill than can be filled. We are headed towards a serious health crisis January 1st, because I think a lot of people are not going to know where to get the prescriptions filled because of what these pharmacy benefit managers are doing to their prescriptions.
I feel like that's a whole nother story for a whole nother interview one day, Jamie.
Yeah, absolutely. But we got to make sure that this is a move in the right direction if it's done correctly.
Yeah.
It needs to be done sooner, and we got to get the DIR fees out of it. But most of all, we've got to get access to the people to the medications they need.
Yeah.
And that's, at the end of the day, that's what it's about, is services to the patient who need these. You know, a diabetic cannot go without their medications, and a heart patient, and, blood clotting is a very serious issue. So, something seriously needs to be done to bring these prices down. And then a lot of these Medicare plans are operating, the patients have so much they can spend a year.
Jamie,
And
I think that's all the time we have. I'm so sorry.
oh, that's okay.
But thank you so much. This was very informative. I wish we had 30 minutes to talk to you, because this is a huge issue that's impacting so many here in this country.
Yes, absolutely. Well,
All
thank
right.
you.
Jamie, thank you.